This is movement analysis by the Avengers. We will be presenting the front squat military press. We are going to divide it into phases. First, the initial phase. Then phase 1, squat down. Phase 2, squat up. Phase 3, military press up. And phase 4, military press down. The initial phase. We will go over the joints, shoulder joint, shoulder girdle, hand and wrist joints, and elbow joint. First, the glenohumeral joint, which is a shoulder joint. It is a ball and socket type of joint. The movements it allows are flexion and extension, abduction and adduction, internal and external rotation, horizontal adduction and abduction, and diagonal adduction and abduction. The agonist muscles are the pectoralis major. The upper fibers are innervated by the lateral pectoral nerve, and the lower fibers are innervated by the medial pectoral nerve. Anterior deltoid is innervated by the axillary nerve, and the coracobrachial is innervated by the musculocutaneous nerve. Synergist is the deltoid posterior fibers, teres minor, innervated by the axillary nerve, tricep brachii, innervated by the radial nerve, infraspinatus, supraspinatus, innervated by the subscapular nerve. The stabilizers are the scapularis, which is innervated by the upper and lower subscapular nerve. Next, we have the scapulothoracic joint, which is not a true synovial joint, but is considered a socket synovial joint. The movements that it allows are abduction and adduction, elevation and depression, upward and downward rotation. The agonists are the trapezius, innervated by the spinal accessory nerve, levator scapulae, innervated by the dorsal scapular nerve, and the serratus anterior, innervated by the long thoracic nerve. The synergists are the pectoralis minor, trapezius lower fibers, and the pectoralis minor. The stabilizers are the serratus anterior, innervated by the long thoracic nerve, and the pectoralis minor, innervated by the medial pectoral nerve. Next is the hand and wrist joints. The type of joint is condyloid. Movements are flexion and extension, abduction, which is radial deviation, and adduction, which is ulnar deviation. The agonists are flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor pollicis longus, all innervated by the median nerve. Also the flexor carpi ulnaris, innervated by the ulnar nerve, and the flexor digitorum profundus, innervated by the median nerve to the second and third fingers, and ulnar nerve to the fourth and fifth fingers. Synergist is the aconius, innervated by the radial nerve. Next up is the elbow joint. The elbow joint is a glenohumerus hinge joint. Movements are flexion and extension, pronation, and supination. The agonists are the triceps brachii and aconius, and they are both innervated by the radial nerve. Now the movements in the initial phase. During the initial phase, we experience an isometric contraction. The action in the shoulder joint are abduction, external rotation, and flexion. Action in the shoulder girdle joint are the abduction, which is pronation, and elevation. Action in the wrist and hand joints is extension. Action in the elbow joint is flexion. Now for phases 1 and 2, we will talk about hip joint, knee joint, and the ankle joint. First up is the knee joint. The knee joint is a gangliosum type of joint. The movements are flexion and extension, internal and external rotation. The agonists are the rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis, all innervated by the femoral nerve. The synergists are popliteus gastrocnemius, innervated by the tibial nerve, and gracilis, innervated by the obturial nerve. Also, sartorius, innervated by the femoral nerve. Stabilizer is a pes nereus. And next up is the hip joint, which is a ball and socket type of joint. The movements are flexion and extension, abduction and adduction, internal and external rotation, and diagonal abduction and adduction. Agonists are the gluteus maximus, innervated by the inferior gluteal nerve, semimembranosus, semitendinous, and the bicep femoris, innervated by the sciatic nerve. The synergists are the adductor magnus, anteriorly innervated by the obturator nerve, and posteriorly innervated by the sciatic nerve. Stabilizer is the erector spinae, which is innervated by the posterior branches of the spinal nerves. And next up is the ankle joint, which is a synovial type of joint. The movements are dorsiflexion, plantar flexion, transverse tarsal and subtalar eversion and inversion, and also pronation and supination. The agonists are the gastrocnemius, soleus, which are both innervated by the tibial nerve. Now for the movements in phase 1. In phase 1, we can experience an eccentric type of contraction. Action of the knee is flexion for phase 1. Action of the hip is flexion. Action of the ankle is dorsiflexion. Now for the movements of phase 2. In phase 2, we experience a concentric contraction. The action of the knee is extension as we return to anatomical position of the knee. Action of the hip is extension. Action of the ankle is plantar flexion. Now for the movements and the joints for phases 3 and 4 are the wrist and hand joint, elbow joint, shoulder joint, and shoulder girdle joint. For phase 3, we experience a concentric contraction. Action in the hand and wrist joints are flexion. Action in the elbow joint is extension. Action in the shoulder joint is flexion as well. And the shoulder girdle experiences upward rotation and elevation. In phase 4, there is an eccentric contraction. Action in the hand and wrist joints are extension. Action in the elbow joint is flexion as well. Action in the shoulder joint is extension. And the action in the shoulder girdle is downward rotation and depression.